Go ahead.
Hi, my name is Colleen Jennings. I'm an RN in Trauma ICU. Welcome to the Burn Fair 2018. We're going to go over the medications that we're using for the burn dressings. First, we're going to talk about pharmacology, pain, and sedation. The opiate analgesics that we use are morphine. We administer PO or IV. The adverse effects include nausea, vomiting, respiratory distress, sedation, and hypotension. One of the things you always want to remember when using any of these agents is your reversal agent. For the morphine, your reversal agent would be Narcan. This may be given IV or IM. Oxycodone, we also administer PO. The adverse effects of this also include nausea, vomiting, respiratory depression, sedation, and possible bronchoconstriction. The reversal agent is Narcan, may be given IV or IM. Fentanyl, we also give. We administer it IV. The adverse effects of this is the respiratory depression, apnea, chest wall rigidity, given in 50 microgram intervals to reduce the risk of chest wall rigidity. So you want to make sure when you're giving that fentanyl, you want to push it slow, and you want to make sure you're aware of your dosages. And also the reversal agent for this is Narcan. As far as your other benzos that we're going to use and sedatives, you use your Ativan, PO or IV. The adverse effects include respiratory depression, prolonged sedation. Reversal agent is Ramazicon, given IV. And for your Versed, you're going to administer IV. Adverse effects include respiratory depression and prolonged sedation. Reversal agent is Ramazicon. So definitely you want to know these two reversal agents also, and you want to pay attention to what drug you want to be giving as a nurse that will work best for the patient. Always consider their age, condition, and what other medicines they have on board. For pharmacology, pain, and sedation, we are using ketamine, seen in our practice with adequate analgesics, unable to be obtained. They produce dissociative effect as well as an analgesic effect. We also give propofol. This is used in the ICU. We use propofol, typically used in conjunction with fentanyl infusion on patients intubated in the trauma ICU. So going over the basics, we have our first degree burns, which we know the epidermis is involved. An example could be sunburn. Our second degree burns, we know that the epidermis is involved, and we have more superficial partial thickness and deep partial thickness. Third degree extends to the subcutaneous tissue, which we usually classify as a full thickness burn. Fourth degree extends to muscle and bone. One of the things that we always want to remember is all patients must have baseline vitals taken before you start this procedure. Continuous heart rate, SpO2, CO2 monitoring throughout the procedures, oxygen delivery systems and suction set up, post-op procedures, and vital signs. Now, especially, and this really pertains to either floor, if you have an awake patient that is not intubated, a Lemon score airway assessment must be performed on the patient without advance prior to initial dressing change. It must be performed by an MD or a respiratory therapist. A score of greater than 4 to 8 requires the presence of an attending MD in initial dressing changes. You want to administer the lowest dose appropriate to the severity of patients, administer and monitor medication in response in a manner consistent to the modern sedation policy, which you can find on SWIFT. Policy number is 5150. And if you have to use a reversal agent, one of the things to remember is that you have to fill out an incident report. And with using Narcan, one of the things that we brought up that is probably new this year is you want to make sure to talk to the pharmacist because continual doses should be administered with Narcan. The pharmacology management, burn, inhalation, injury, the burn inhalation order set. You want to order with actual and suspected inhalation injuries. And you want to have your treatments administered by respiratory therapist Q4 for 7 days. You also want to have your heparin solution. All of these things you need to make sure that you get with your respiratory therapist, go over the order sets, and make sure that your burn order sets are specific to the patient's needs. When we have grafts, some of the things, if we have topicals that we use Dankin solution, we use sulfamylin solution. What we've been using lately, and more often, is sulfamylin cream with the nystatin bacitracin powder. It reduces the risk of infection, spreads easily for simplified application, can be washed off readily with water, and it's non-staining. So in summary today, one of the things that you want to remember is make sure that you have the correct orders for the patient condition that you have. You want to make sure that you verify those orders. You want to make sure you have the proper equipment to monitor the patient during the change and to monitor the patient before, during, and after dressing changes. And you want to make sure that if you have anything as a lemon score or any warning signs that you may need for different orders, you always want to keep in contact with the doctor to make sure you clarify the orders that you need. Thank you.